Thank you, everybody. Today I'm going to provide COVID-19 updates. Then Chief Martinez is going to provide a vaccine update and take questions on any COVID-related questions. Superintendent Casillas is going to provide updates on the Boston Public Schools and where we are as far as the schools today and reopening. And after my remarks, Superintendent will come up first. Marty Martinez will come up, and then they'll be answering questions on schools or COVID. I also want to thank Joan and all the ALS interpreters who have played a very crucial role in our city's response to the COVID-19 pandemic. They've helped us ensure that everyone has access to vital public health and safety information, so I want to thank you for your incredible work. As of yesterday, the latest COVID numbers, the state numbers 5,278 new confirmed cases, bringing the total cases of COVID-19 people in Massachusetts to 427,752. There were 86 deaths reported yesterday, bringing the total deaths in the Commonwealth to 13,082. Our Boston numbers yesterday were 352 confirmed cases, bringing the total cases in Boston since the beginning to 46,558. There were 7 people that were reported that lost their life to COVID, bringing our total in Boston to 1,067. As always, our prayers go out to those that are sick and suffering, and the families with COVID-19, and prayers for all the families who lost loved ones during this very difficult time. Our latest complete data for the week ending January 7th, we had an average of 5,921 people were tested each day. That's up significantly from the prior week of 25%. That does not include college testing, so it's good to see people getting tested. We're going to continue to encourage people to continue to get tested. The average number of positive tests for each day was 542. The unfortunate part about increased testing, that number went up as well, up about 25%. Our current community positivity rate is 8.7%. That's about the same as it was the week before. East Boston, Dorchester, Hyde Park, Mattapan are neighborhoods still with the highest positivity rates right now. Our case numbers are concerning. Our hospital numbers are higher than we'd like. 98% of adults, non-surge ICU beds are occupied. It's the highest we've seen in quite some time, since almost the beginning of the first surge. We're in constant contact with hospitals to support them. We had a call the other day with the hospital presidents. As of right now, there is no need to reopen Boston Hope, but Marty can talk a little more about that in a little bit. We need everyone to continue to do your part. I know that everyone is tired, and you're tired of hearing me and the governor and everybody talk about what we need to do, but we have to stay focused. We have to take care of each other a day at a time. Everyone should be thinking about the simple steps they can take on a daily basis to avoid the spread of COVID-19. Every time you wear a mask, every time you wash your hands, avoid a gathering, you could be saving a life. Businesses and employers, every time you enforce safety protocols to let people work from home, you could be saving a life as well. So I ask you, everyone, to please continue to do that as we go through the next couple of weeks here. We are seeing numbers from the holidays. We're seeing lots of different reasons why these numbers are going up, so we want you all, it's within our own control to control this virus. At my State of the City address the other night, I said Boston has been knocked down before, but we always get back up. In 2021, Boston will rise up again. This is how we'll do it. We do it by looking out for each other, by protecting each other, by washing our hands, wearing masks, physical social distancing, doing all the things that we have to do. Every single Bostonian, every single person in the Commonwealth has a role to play. I want to thank everyone for all of the work that you're doing, staying strong, staying focused, and doing your part. I also want to remind everyone to get tested. It's quick, it's easy, and we have 30 sites in the city of Boston. We also have mobile sites which are free and open to the public regardless of symptoms. This week they're in Hyde Park at the Boston Renaissance Charter School. It's a drive-through location. You don't have to get out of your car. It's by appointment only. It's a nice, easy way to do it. In Roxbury at Washington Park Mall, this is a walk-up site, and registration is required there as well. In Grove Hall at Prince Hall Grand Lodge, this is a walk-up site and on-site registration, so when you go there you can register on-site. And in Jamaica Plain at the Anna Cole Community Center, This is a walk-up site. No appointments or registrations are required, so you can just walk there. If you do go to that one, there might be a line there, but it's worth the wait. It's quick. They move people through pretty quickly. Dates and times vary, so if you go to boston.gov or call 311, you'll get a complete list of details. I just want to thank the people of Boston for their strength and resilience over this past year and always. And I want to say thank you to all and well wishes and kind words I received over the past week. As I said Tuesday night, this city is not just my hometown, it's my heart. The work continues. We certainly have better days ahead, and we're going to continue to stay very vigilant to make sure that we beat this virus. This virus will not beat us, will not beat this city, will not beat this Commonwealth, will not beat this country. So I ask you all to be careful and take care of each other. With that, I'm going to turn over to Superintendent Casilius to discuss BPS reopening, and then I'm going to turn over to Chief Martinez to talk about coronavirus, and they'll be taking the questions. I will not be taking any questions.
Thank you, Mayor, and thank you to everyone here today. I'm so very grateful to you, Mayor, for your steadfast leadership throughout this pandemic, and thank you to so many of my city colleagues, especially Chief Martinez and Chief Brophy, who have been instrumental in helping us get to this point today. It's been an all-hands-on-deck effort to ensure the health and safety of our entire Boston community, as well as the Boston Public Schools, which serves 53,000 students in 125 schools, and with a diverse school district, 22% of our students have disabilities and 75% of our students are categorized as high needs, many of whose lives has been disproportionately impacted and turned upside down by this pandemic. Over the past several months, we've partnered closely with Chief Martinez, Dr. Lowe, and the team at the Boston Health Commission as we've depended on their advice and health and guidance to help us understand the virus and to help mitigate the risk as we've been prepared to open safely. And soon they will be helping us expand COVID testing and administer vaccines to our K-12 community. Better days lie ahead. I'm so proud of our entire BPS team, our school leaders, our educators, nurses, custodians and facility staff, our food service workers, our bus monitors and drivers, and central office staff, and just everyone who has tirelessly worked this year to ensure the health and safety of our children. I know that they are all very exhausted, but I want to thank them for showing up every day, whether remote or in person. They are making a difference, and I wanted them to know that they are appreciated. I've stood at this podium many times this year and have said that children do not get a rewind. They only get one chance at a childhood. We have been determined to provide that as best we can in this remote environment. And a big shout out to our teachers who have been reinventing their practice and keeping our children engaged. And still, we know that the best learning environment for our students is in their classrooms, with their peers, under the care of their loving educators and staff who miss them. It's been close to a year that our students have been out of school. Many of our students have needs that can only be met with in-person services. And we've heard from so many of our parents who have seen their children's academic performance and health improve when they are returned back to school. Other parents have told me that they've seen a spark when their children return, and their children are just so much happier, and there's been a boost in their spirits. During this incredibly challenging time, in all of our lives, many of our students are struggling emotionally. Our schools are safe places for our young people, and our educators and staff provide students with the invaluable love and support that they so need. We often say our parents are a child's first teacher. Well, this year that has been more true than ever. But they are tired, and we have heard from so many of them that this cumulative effect on their children and the year away has taken a toll on their students and their families. Just a few days ago, parents returned to City Hall to express their frustration. I want you to know the mayor and I hear you. We acknowledge how difficult this has been for you and your children and your family. That is why we are standing here today with relief and hope, with a timeline to returning students to school. It may not be fast enough for some. It isn't for me or the mayor either, but it is a timeline that we will provide certainty, and it will move us forward to stability for the remainder of this school year. On Monday, we announced a revised timeline for bringing more students back to school buildings for in-person learning. Currently, we have approximately 1,900 students learning in person at 32 of our schools. Beginning February 1st, we will welcome additional students with high in-person priority needs across all of our schools. We anticipate approximately 4,900 additional students being invited to return to our school buildings on February 1st. These students, recognized as having priority for in-person learning, include high-need Level 4 students with disabilities, English language learners, Levels 1 and 2, students who are in the care of Department of Children and Family, students who are experiencing homelessness, students with limited or interrupted formal education, students identified by schools by their student support teams and for additional in-person learning. Some students with high in-person priority will learn in person for 4 days a week, while others will choose to still be in person for 2 days a week. 4 weeks later, we plan to welcome back the remainder of our students every 2 weeks, beginning with our youngest learners. The week of March 1st, all students K0 to grade 3 will have the option of returning. The week of March 15th, all students in grades 4 through 8 will have the option of returning. And the week of March 29th, we will begin bringing back our high school students. If necessary, any of these phases may be postponed based on the current public health environment and on the advice of Boston Health Commission. Our plan has always prioritized parent choice. That's why parents can opt in or opt out of the hybrid model. That means any student can have the option to learn remotely if they like to 5 days a week. While we are working hard to restore in-person learning for additional students, we remain committed to providing high-quality remote learning because remote learning is working for some families. Again, I'm thankful to our educators, their tireless work this school year to adapt their skill set to be there for their students. All of this is possible because earlier this week we were able to reach a new agreement with the Boston Teachers Union, codifying our shared commitment to open schools safely. We will be implementing the same health and safety protocols currently in place at the 32 schools that are already open across all school buildings when the remainder open February 1st. These health and safety protocols include limiting the number of students and faculty in a building to ensure social distancing, instituting creative scheduling and staffing to ensure the health and safety of our students, providing air purifiers or HVAC filters for our schools, increasing air quality testing and reporting, installing data loggers for on-time, real quality air quality measures in our schools, delivering additional personal protective equipment for students and staff, offering access to free COVID testing for teachers on site or nearby a school. We are also expanding our pilot that we had prior to winter break for students in COVID-19 testing. We are also continuing to report all positive confirmed cases in our schools, to our school community, and to our public, which can be found on our website. I'm thankful to the leadership of President Tang and also to the BTU members. I am looking forward to turning the corner in a new year with our renewed collaboration as we look forward to reopening, as we look towards summer programming and an even stronger return this fall. Together, we are working to rebuild trust, create stability, and provide certainty for our educators, our families, and all of our BPS community. We have to get our students back in school, and in order to see this happen, as scheduled, we need the help of all of our Bostonians. We need adults to change their behavior. We need you to help so we can all be safe and open safely. So please, let's all do our part. Because together, if we all adhere to the public health guidance by wearing our masks, by keeping our distance, avoiding small gatherings, washing our hands, and staying home, or if we're not feeling well, for sure staying home, we will lessen the spread. It's going to take all of us. Let's do this for our kids. They deserve nothing less. Thank you for helping us share this information and for helping us get our children back to school safely. Chief Martinez.
Good morning. I'll just offer a few quick thoughts before the superintendent and I will take any questions that you may have. when we think about reopening schools, we think about prioritizing essential services. And while we're living with COVID, we have to do that. So thank you, Superintendent, for your leadership to make that happen. But one of the other tools that we have to use is obviously getting folks vaccinated. And right now in the city of Boston, we are partnering with the state to ensure that vaccinations can happen according to prioritization, but doing everything we can to make them accessible. As of yesterday, the city of Boston, in partnership with Tufts Medical Center, has vaccinated over 1,100 first responders in partnership with Tufts as well as BMC. Those are members of our fire department, police department, and EMTs, with over 1,100 folks vaccinated. We have more scheduled for today and tomorrow, and we'll continue to vaccinate first responders all through next week until we get everyone vaccinated who wants to be vaccinated in those departments. In addition, we're partnering with the state to continue down the list in the first priority to ensure that folks living in congregate settings are also getting vaccinated. We will begin next week in partnership with Boston Healthcare for the Homeless to vaccinate in our homeless shelters and to vaccinate not only homeless shelters but family shelters and other group settings to make sure that those most vulnerable and living in vulnerable settings can also get vaccinated. In addition, we're continuing to partner with our hospitals and healthcare providers as they vaccinate workers within the hospital to ensure that they can do that. Not surprisingly, and I know folks know this, but we continue to see hesitation in our diverse communities and our black and brown communities here in Boston to get vaccinated. So we're partnering not only with our hospitals and health centers, but community-based organizations to continue to raise awareness about the vaccine, its safety, how it was studied, and to do everything we can to ensure folks get vaccinated when they're able to get vaccinated. We'll continue to partner with the state in this first phase, and as we continue to plan for the second phase, which includes seniors living in affordable housing and living in subsidized housing. It includes vaccinating K through 12 educators. It includes vaccinating additional essential workers, and we're continuing that planning effort in partnership with the state. The city's committed to ensuring that one of the critical tools we need to get through COVID, vaccinations, happens, and that we do it in a way that's going to ensure that we can do it as quickly as possible following the state's leadership, given the role that they play across the board. So we will continue to do that and continue to provide updates. We are working in partnership with the state on mass vaccination sites, as well as trying to create additional vaccination sites across the city. The mass vaccination sites, as you've heard reported before, include planning at Fenway Park, as well as in conversations we are having with healthcare providers to look at the Reggie Lewis Center at Roxbury Community College. We are committed to ensuring that sites are available and accessible in all neighborhoods as much as possible to ensure folks can get vaccinated, and that's something that we are committed to as the city to use that tool. The last thing before I open it up for questions, the mayor wanted me to share with you that we continue to monitor the events in the Capitol, and obviously the inauguration is next week. We continue to be prepared for any challenges we may see here based on the threats that have been happening targeted D.C. We have no credible threats here in the city of Boston right now, but the Boston Police Department, working in partnership not only across the city but also with federal authorities, will be well prepared for any challenges we may see, but currently we have no threats here in the city of Boston, but we'll continue to monitor that situation. So with that, if you have questions related to COVID or questions related to BPS reopening, myself and the superintendent are glad to take them.
First question, why isn't the mayor taking questions?
Yeah, so great question. Because we're focused on COVID and the work that we're leading around COVID and the work we're leading around reopening, we are focused on being able to answer those questions. As you all know, the mayor is beginning a process to get confirmed as the labor secretary. And so his focus is both to not only run the city, but to also to be able to do that. So we're able to answer any questions you might have about COVID or BPS reopening, and we're glad to do it.
Yeah. Reading in between the lines there, the finance team tell Marty, don't answer any questions until you're confirmed. It's essentially nothing happens.
Yeah, so the reality is myself and the superintendent provide leadership in these areas, and we're glad to answer any questions you might have about these two pieces. Sorry, go ahead.
Will we hear from the mayor ever again on these issues, or will he be so focused? Is that it? Is that it?
Yeah,
I'll
so.
ask about that. Go ahead.
Yeah, I was going to ask, there's a possibility that we might have a special election here, and as the Health and Human Services chief, would having a special election, which would be essentially 2 elections, preliminary and general, would that pose additional public health risks?
So for me, looking at all we've done around COVID, as you know, and those of you who've been here for a while know, the question was whether or not having a special election is a health risk around COVID. There's no question, as someone who's poured my blood, sweat, and tears into managing our COVID response, we want to do everything to keep our community safe. The decision of whether there's a special election is not up to us as city officials in this process. If there is a special election and there's more elections, we will replicate what we did through the city to keep people safe when they voted last year, and we would make that accessible. If there's not a special election, we will still make sure when there is election that the protocols are followed and people can safely vote and exercise their voice. Yeah.
Your name has been floated at times for mayor. Is there anything to that?
So the question is whether or not I'm thinking of running for mayor. As I've said, I've been focused this entire year on the COVID response and leading that response, and I'm proud of the work we've done, but there's much more to do, and so I'm still intensely focused on it. Having said that, the next mayor who's elected to the city of Boston will have a huge responsibility to make sure we can finish this response and get to an equitable recovery, and I'm absolutely considering running for mayor. Next question. Yeah, so the question has to do about max vaccination clinics, the planning going into that, and all the complexity that comes with that. Absolutely. I mean, it's very complex. I mean, this is a state-led, federal to state-led effort to ensure that vaccinations happen. But the city has experience with vaccinations. We have experience with being able to do it not only through the flu, but H1N1, and making sure that we can vaccinate individuals across the city. So we are in the midst of planning that right now. What does it mean to make sure you have space for folks to have a 15, 20-minute observation period? How do you make sure that you have availability to take through large numbers of people to get vaccinated? How do you ensure you're following the prioritization that's been laid out so those most vulnerable get vaccinated first? Making sure that in diverse communities these clinics are accessible in neighborhoods where people may have hesitancy to get vaccinated. So the city's working through all that through our Boston Public Health Commission and our emergency planning efforts. But there's no question, I mean, the state, the federal government to the state and then to the city, having a clear understanding of when and how many doses will be available. That is something that the state continues to advocate with the federal government for. You need to have a clear understanding of the number of vaccines. You need to have a clear understanding of how many doses you'll have and how many doses you'll have for the second shot that you'll need, which is incredibly important. But I think the hospitals, the healthcare system, as well as BPHC and all of our partners, we are actively planning every day to make sure that as vaccines get released into the city and into our own ability to control, that we will make sure people can get vaccinated. But I don't want to underplay your question, which is it's incredibly complicated to vaccinate the number of Bostonians we need, and we need 75–80% of folks to get vaccinated, and that's the work we're trying to put together right now.
Currently in the city of Boston, I know you mentioned there were 1,100, but do we know a number of how many have been vaccinated throughout the city? And secondarily, there's been a lot of criticism about how vaccinations have been rolled out. I'm curious to see if you're experiencing any of that here in the city, and what you're finding. Has it been a slow process that could have been done better?
Yeah, so the question is how many Bostonians have been vaccinated, and some of the criticism about the slowness of the process and sort of how we've seen that play out. We can get you the exact number of how many folks have been vaccinated. It's the state releases a dashboard every week, and that vaccination gives you by county, and so that's an incredible. That's where we would get the information, but we can share it with you. Folks getting vaccinated right now are healthcare workers who are working in our hospitals and other healthcare institutions who are COVID facing, folks in our long-term care facilities. Almost almost all Boston long-term care facilities have been visited twice by their pharmacy partner to get folks vaccinated. And then we're also focused, obviously, on our first responders and getting them access. And again, as I said, we have over 1,100 who've been vaccinated. There's no question that trying to loosen up the amount of doses has been important through the federal government to the state. And the state is focused with us to make sure that there's access points. But we are eager to make sure that as we plan for vaccinations, that we can not only make sure that they're available to get them, but I don't want to undersell something that I think we sort of forget in this conversation. There are many, many people, many Bostonians in our diverse neighborhoods who are not ready to get vaccinated, who have hesitancy to get vaccinated. And so we need to make sure we're doing that legwork and advocating around it and raising awareness, and that's also a key part of this. So it's a complex system of things we're trying to work through, but we believe that we are on course in partnership and through the state's leadership to make it happen.
People doing what you want them to do, maybe wearing masks, washing hands, following public health guidelines. What makes you think this is going to work better this time than other attempts to keep open schools and keep them open?
So can you say the first part of your question again? I'm sorry.
Regarding opening schools, everything's going. It seems like everything is hanging on people doing what they're supposed to do, which is washing hands, wearing masks.
Yeah.
I mean, what makes you think it's going to work better this time than it has in previous attempts?
Yeah, so the question is, as we open schools and we think about people doing what they're supposed to do in order to help keep people safe, as the superintendent said, we are doubling down on making sure that Bostonians can do our very best together and following public health guidance. I think it's really important to remember, though, that when we close things down and we restrict things in the city, we do that because for two reasons. One, we want to slow down the spread of COVID, but we also have done it in the spring because our healthcare system was struggling to take care of those who need it. Our healthcare system in Boston is not at the place it was in April and in the spring. In the spring, we had 1,500, 1,600 COVID positive patients in our Boston hospitals. We had most services outside of COVID not being able to be provided. That's not where we're at today. We have roughly 420 COVID positive patients today, and our healthcare system, although stretched and although the capacity is tight, is firmly in control of what they're trying to do to take care of those who need it the most. The reason I share that with you is that when we think about essential services like educating students who need in-person learning, we have to make sure we're balancing all of these metrics. We know Bostonians are tired. I know some of you are tired. I'm tired in many ways, but the reality is that we've got to focus on the essential services, and educating students in person who are high needs is an essential service, and we think we can do it under the current conditions. Yeah, it's a great question, and the additional efforts to encourage folks to wear masks and socially distance, and that has continued. I mean, while so much of the conversation has been on vaccines lately, we have so many more months to go, many more months to go, where we need people to wear their face covering, socially distance, not interact with people outside of their own household. So we've done a variety of different efforts, including partner with community-based organizations in every neighborhood of the city to make sure that folks are getting that message out into their neighborhoods, out into families. We've been working with school leaders to also help them with information so they can share with their families and make sure that testing is accessible. And so the reality is that we're trying to prioritize, again, those essential services while we live with COVID, because I know everyone doesn't want to hear this, and it's tough to hear, but we will be living with COVID for quite a while, and we need to make sure we can do everything possible to keep everybody as safe as we can.
Face the threat of our protests this weekend. What is Boston doing in response to this? I know it's outside your bailiwick.
Sure.
Since your person was here, you brought up.
It's a better question for people here. Danny will follow people with you after that.
Sure. Yeah, we'll connect you to the police department around that question. Thank you, everyone. Ready.